Welcome to part 2 of today's lecture. We're going to talk about Class E pharmacy. So go ahead and grab that worksheet and let's get after it. When you hear the term Class E pharmacy, the first thing that I want you to think about is not in Texas or ain't Texas. Whatever helps you remember that these pharmacies are not located in the state of Texas, but they do help serve the patients of Texas. The Class E licenses are granted by the Texas State Board of Pharmacy after an application process similar to what Texas pharmacies go through, but they have certain regulations and requirements that they meet to be able to service the patients of Texas. Their primary businesses is to dispense a prescription drug or device to patients in Texas. They are able to process a prescription drug order for a patient in Texas. And lastly, they are able to perform other pharmaceutical services as defined by Texas State Board rule. The best way to, or the easiest way to think about these pharmacies is think about your elderly grandmother. She has Medicare Part D, and through her program, she has an option to opt in to mail order pharmacy to prevent her from having to get out, drive, and actually go into the pharmacy to pick up her medication. The mail order pharmacy can actually send it to her house. One of the things to know about this situation is that the mail order pharmacy is actually maybe in New Jersey. For that pharmacy to be able to send her medication and service her prescription needs, that pharmacy actually has to be a Class E pharmacy licensed through the Texas State Board of Pharmacy. To become a licensed Class E pharmacy in the state of Texas, pharmacies must have a license in good standing in their home state. Just taking back to the example that we talked about earlier with the pharmacy from New Jersey, that pharmacy cannot have any demerits against their home state license to be able to be qualified for a Class E pharmacy license in Texas. Also, individual pharmacists working in the pharmacy do not have to have a Texas license individually, but the pharmacist in charge of that Class E pharmacy must be a licensed Texas pharmacist. Licensing requirements and maintenance of a Class E license really mimic what a traditional Texas pharmacy would go through today. They have to apply like they normally would. They're up for renewal every 2 years. They're subject to inspections. But one caveat to this is note that if the board does go in and inspect these non-resident pharmacies, that pharmacy is actually responsible for paying the travel expenses for the board officers or inspectors at that time. Also, unless compliance would violate the pharmacy or drug statutes or rules in the state in which that pharmacy is located, all Class E pharmacies in the state of Texas must abide by Texas State Board of Pharmacy rules relating to its purpose, definitions, personnel, operating standards, and records. A lot of times, I don't know if you guys have heard this yet or not, but Texas law is pretty strict. Texas law, a lot of times, is stricter than federal law. So a lot of times it's other states adapting to what we do in Texas versus the opposite of what we don't do that the other states do, I guess is the easy way to put it. So a lot of times this is pretty much an adjustment that the Class E pharmacy has to make in order to service our patients in Texas. 3 important operational standards to remember regarding Class E pharmacies are as follows. First, these licensed pharmacies must comply to the Texas Health and Safety Code, which involves the Texas Controlled Substance Act. They also must understand Texas substitution requirements regarding generic versus brand medications. So if a patient has a prescription written by a doctor that's directions has a brand medically necessary indication, then they must dispense the brand. Also, they must understand the patient's right to refuse a generic substitution. So if they want a brand medication, they must honor that request. And then lastly, they must have a mechanism of notifying a patient of their rights to refuse generic substitution. And then lastly, these pharmacies also must offer patient counseling since it's required for all new prescription drug orders in the state of Texas. Since prescriptions filled by a Class E pharmacy are mailed to the patients, they are actually treated as delivery prescriptions as a normal Texas pharmacy would have. A Class E pharmacy may meet the counseling requirements by providing written information regarding the prescription drug, along with a statement that a pharmacist is available via a toll-free telephone number for counseling. So a lot of times, even though a patient might have had this medication before, it could be a refill, the pharmacy that's registered as a Class E will just go ahead and send all the prescription information just so that it meets that requirement over and over again. So guess what? Class C pharmacies have record requirements as well. So every record that is kept by the pharmacy is required to be available for at least 2 years from the date of such inventory or record of inspection. And these pharmacies that are licensed as Class E must be able to provide dispensing records within 72 hours of the State Board of Pharmacy request. And there's also one other license type that can be available through Class E, and that's a Class ES pharmacy license. And basically, this is a Class E pharmacy that compounds sterile products, but they must register with the Texas State Board of Pharmacy as a Class E pharmacy before doing so. Basically, this requires an auditor or an inspector to come up to that pharmacy, do an audit, make sure that they're following all the sterile compounding requirements before that license is issued. And once they are granted that license or authorized to have that license, then they're able to basically ship sterile products to the patients of Texas.